everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. Today we're going to be discussing a medication known as Amoxicillin. Its brand name is Amoxil. Now before I talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. So amoxicillin is a semi-synthetic antibiotic that inhibits the biosynthesis of the cell wall mucopeptide. It's similar to penicillin with bactericidal effects on many organisms, including both gram-positive and gram-negative. In terms of indications for use, amoxicillin is indicated to be used in the treatment of infections of the ears, nose, and throat. It's sometimes used to treat gonorrhea. This medication can be given with other antibiotics to treat H. pylori gastrointestinal tract infections. It can be used to treat infections of the skin or the subcutaneous tissue. It can be used to treat infectious diseases of the genitourinary system. Amoxicillin can be used to treat lower respiratory tract infections. And it can also be used for pharyngitis as well as sinusitis. Now, before somebody was to use amoxicillin, there are some contraindications that they must clear, as well as some precautions and warnings that they should be made aware of. Amoxicillin will be contraindicated to be used or given to patients who have had severe anaphylactic reactions or other skin conditions resulting from its use, such as Stevens-Johnson syndromes, if they've used amoxicillin or other beta-lactam antibiotics, so penicillins or cephalosporins. Now, in terms of precautions, it's a good idea to make patients aware that Clostridium difficile associated diarrhea has occurred after the use of amoxicillin. In some cases, this can occur up to 2 months after the first capsule of amoxicillin is taken. If C. difficile is suspected or confirmed, the patient would stop all antibiotics that they're taking that are not targeted towards C. difficile. Patients should be told that severe anaphylactic or allergic reactions have occurred with the use of amoxicillin, and they should monitor for signs of this during their first couple of doses. And finally, we should avoid giving this medication to patients who have mononucleosis, as there would be an increased risk of experiencing a skin rash. Now, once somebody is cleared of the contraindication and made aware of the precautions and warnings, and they start to use amoxicillin, they can expect to receive their dose orally. If somebody is using amoxicillin to treat a mild to moderate infection of the ear, nose, throat, or also for skin infections, they can try using 500 milligrams every 12 hours or 250 milligrams every 8 hours. For severe infections, they may try 875 milligrams every 12 hours or 500 milligrams every 8 hours. If somebody is using amoxicillin to treat Lyme disease, they may try 500 milligrams 3 times daily for about 14 days. However, there would be a dosing range here of 14 days to 28 days. For lower respiratory tract infections, they may try 875 milligrams every 12 hours, or again 500 milligrams every 8 hours. Now, as with all medications, there are some side effects or adverse reactions that patients may experience while using amoxicillin, so I'll go over some of those here now. Some patients that use this medication may develop a rash. Diarrhea, nausea, and vomiting are possibilities with amoxicillin. Some patients may experience a headache while using this medication. The risk would be increased if they were using amoxicillin as part of a cocktail to treat H. pylori. Now, some more rare but serious side effects would be dermatological side effects such as Stevens-Johnson syndrome or toxic epidermal necrolysis, the development of Clostridium difficile or C. difficile associated diarrhea, and finally, anaphylaxis or a hypersensitivity reaction. That's all we're going to talk about today with amoxicillin. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, you can like the videos, share the videos, or most importantly, subscribe to the YouTube channel. There's also some links in the description you can check out as well. That's it for today. Take care.